This is a case of a 34-year-old female patient came to the OPD with the complaint of nasal bleed, recurrent in nature, last episode 1 day back, which is profuse in nature. On doing a nasal examination, we see there is a nasal mass confined to the nasal cavity attached to the septum. Patient underwent CECT, which shows the nasal mass confined to the nasal cavity and the attachment to the nasal septum. Suspected of lobular capillary hemangioma. We planned for nasal endoscopic excision using a Coblator. So there is a two mode in the Coblator, coag mode and the ablation mode. First, we use the coag mode to cut off the blood supply from the nasal septum to the nasal mass. We delineated the attachment and used the coag mode of the Coblator to cut off its blood supply, so it reduces any further chance of bleeding. Once we delineated the nasal mass, and then we can see that there is no any blood ooze or any blood in the area. We use further ablation mode to cut off the nasal mass from the nasal septum, and it's completely removed, and we can see that there is no further damage of the normal nasal mucosal tissue. Here we are using ablation mode to cut off the nasal mass. The beauty of the Coblator is that it can do suction simultaneously, so the nasal saline or the blood in the field gets sucked out and keep the field very clear for the further dissection. So that we can see that nasal mass is removed and the nasal septum, the suspected area of bleeding or ooze, is further coagulated. The nasal septal cartilage remains intact. There is no any damage to the nasal septal cartilage. So by doing this, we can achieve complete hemostasis. For the precautionary point of view, you can put Merosil for 12 to 24 hours, or you can keep under observation, and there is no requirement of Merosil also. We can put nasal saline and oxymetazoline further to reduce any chance of bleeding. The complete excision and the nasal examination is done so that no any remnant tissue in the nasal cavity. Thank you.